Thanks, Jean-Christophe. And I'm going to take us on a little bit of a slightly different angle just to relate some of this particularly to COVID-19 and the Sustainable Development Goals and multilateralism, and just particularly to think a little bit about how some of this is affecting children and families. First, I though just a big thanks to the Center for China and Globalization for organizing this. It's been very interesting this afternoon. One of the things I think that we've certainly noticed, and I'm sure many others, is that COVID-19 has revealed inequalities that really threaten the achievement of the Sustainable Development Goals. For example, the socioeconomic impact of COVID-19 is being felt hardest by the world's most marginalized and vulnerable. And with many people globally already living in poverty, the consequences of COVID-19 risks plunging them even further into hardship. Even before the COVID-19 crisis, we needed an additional $2.5 trillion a year of investment to close the financing gap for meeting the Sustainable Development Goals, and about half of that requirement for Africa. So where we were already before we had this pandemic this year, we needed fresh, innovative ways of reducing inequality and addressing poverty, responding to the problems we already had with things like financing gaps to meet the SDGs. And now we have to address and respond to new problems like COVID-19 with a nuance to make sure that our interventions, which are going on for 6 months now and may have another year at least ahead of us, do not inadvertently make things worse. I'd like to give you two potential examples of that. First of all, I'd like to give you the example of school closures globally, which have been a major feature of countries' responses to COVID-19 and have left more than 1 billion school children in more than 130 countries out of school. Now, we can all understand the epidemiological and communicable disease control rationale behind those kind of interventions. There is, though, overwhelming evidence on the negative impact of school closures on children's physical and mental health, their nutrition, their safety, and their learning. Let me give you a few examples. School closures can increase children's exposure to physical, emotional, sexual violence. Children are more vulnerable to child labor if they're not in school. Millions of children, particularly in rural areas from poorer families and such like, rely on schools for meals, and this can lead to nutritional problems not being in school. And again, even prior to the pandemic, most low and middle income countries were facing a learning crisis. So prolonged school closures are likely to cause students to regress academically and cause significant learning deficits, especially given online learning is only temporary and doesn't necessarily benefit every child everywhere. So for all of these reasons, schools should be among the first public services to open when COVID-19 safety measures are put into place. And of course, we recognize the decisions of when to open schools. They must be made in the best interest of children. Adjustments need to be made when there's new information or outbreaks or risks change in local transmission and other conditions. But they should be the first services to open when it's safe to do so. Secondly, evidence is also showing the negative effects of COVID-19 on maternal and child health more broadly, and we already had problems in this area. So for example, a recent Lancet Global Health publication predicts that around 6,000 children could die every day from preventable causes over the next 6 months or so as the COVID-19 pandemic continues to weaken health systems and disrupt routine services. Now, this increase is avoidable if, in partnership, we work across sectors to prevent transmission of COVID-19, treat those who fall sick, but also address these unwanted effects of the type of responses that we have been aiming at to contain the spread. So, for example, prioritizing maintaining routine health services for all children and mothers, as well as ensuring COVID-19 prevention. That may mean separation of cold and hot hospitals and such like measures, to make sure that immunization, antenatal care, other routine services continue safely and avoid further health problems that will ultimately challenge SDG attainment. And obviously we need to do that whilst curtailing public fear about accessing health services by creating those safe and patient-safe environments for routine and emergency healthcare. So with those two examples, finally, let me say that I don't think that South-South cooperation, multilateral engagement, partnership has ever been more important than it is now for the SDGs. It was already very important, and then we hit the pandemic. Our response here in China as UNICEF has been to bring in essential supplies during the epidemic here, first in China in January, and then working on a back to school campaign with the Ministry of Education and China CDC to get that public service opened as soon as possible and as soon as it's safe to do so. We've been sharing lessons with many other countries as we go along, and I think that's an incredibly important thing that we can advocate for together. On China's side, we've continued to grow our partnership with the Ministry of Commerce and the China International Development Cooperation Agency to deliver results for families under the whole framework of South-South cooperation. And already in the last few years, we've seen China contributing hugely to maternal, newborn, child health, early childhood development, humanitarian projects across a whole range of UN agencies, working as a trilateral partner, all to achieve the Sustainable Development Goals. So let me just finish just by saying that it's something I was saying to my family recently. There'll come a day when you and your family will go to a health centre to receive a vaccination for COVID-19. And you'll come outside afterwards and perhaps you'll say to each other, that's finally over, and breathe a sigh of relief. But until we get to that day, we need to focus our efforts together to address the old problems, to find solutions to new problems, and make sure our response to COVID-19 doesn't inadvertently exacerbate the situation for the most vulnerable and take us even further away from achieving the Sustainable Development Goals. So, thank you.